In this video, we will be demonstrating a step-by-step application using the low-volume macro infusion pump. In this video, we will be treating an oak for chlorosis, but this process can also be applied to oak wilt treatments with Alamo. When you first arrive on site, it is best to inspect the tree for girdling roots, root rot, or any other signs of stress. Not all trees may require excavation, and you should excavate enough just so that the injection sites are 4 to 8 inches below the crest of the root flare. Use a shovel or trowel to remove sod and soil from around the base of the tree. Careful not to damage the trunk. Thoroughly brush loose soil from the root flare using a coarse brush. Soil left on the root flare can dull drill bits, clog tees, and increase uptake time. Next, you will be drilling the holes for injection sites. You will need to use a 15/64" high helix drill bit, and we recommend changing out drill bits every 5 trees to ensure sharpness. Place the drill perpendicular to the surface of the flare and quickly drill in and out about 1 inch into healthy xylem tissue beneath the bark. Make sure not to spin the bit while in the tree. This can cauterize the injection site, sealing off some of the tissue and reducing uptake efficacy. You will want to use 1.5 infusion sites per dBH inch, which comes out to approximately 1 T every 4 to 6 inches. Some things you want to consider when making infusion sites is, make sure you have at least 1 infusion site for each root flare. Do not place infusion sites into or below dead tissue, and do not drill into deep valleys or sunken areas. When you drill, you should get a cream-colored pigtail that comes out of the infusion site. This indicates that you are drilling into healthy tissue and the drill bit is sharp. If the material coming out of the drill site is dark and crumbly, this usually indicates that you have hit a decay pocket and should reposition your infusion site. As you begin inserting your tees into the infusion sites, inspect the tees to ensure they are clear of debris and replace any damaged tees you find. Firmly place tees into the infusion sites by hand to form a continuous ring around the base of the tree, looping the tubing up and down in an S-shaped pattern. Do not push too hard or pound the tees into the site, as this can restrict distribution of product. You will now want to open up 2 sections in the harness on opposite sides of the tree by removing one end of tubing from one of the injection tees. You will use your supply tubing and black connector tees to attach the supply tubes to your pump. Now you will begin priming the pump by adding water to your tank. Prime the pump by pumping the handle and removing one of the tees to bleed out all of the air bubbles. Now you can start pressurizing your pump by pumping the handle, run only water through the system at first while priming, and use this time to check for any leaks or loose tees. If you find loose tees, gently tap them into the infusion site to secure them. If any of your tees continue to leak, you can either drill a new site or bypass it with a longer piece of tubing. When determining dosage for your treatments, please refer to the product label for specific rates. Stop the pump by closing the valve on the hose attached to the tank and add the product and any remaining water. When releasing the valve, make sure to maintain a pressure of 15 to 20 psi, which can be adjusted by the pressure relief valve at the top of the tank. Inspect the harness and tees one more time, then pack up your remaining gear. From there, you should monitor the system to ensure uptake and watch out for any tees that may come loose. Once the tank is empty and pushing air, you may remove the tubing and tees, keeping them in 6 to 10 foot sections for easier use next time. Do not treat the infusion sites with wound paint or any other sealing compounds, and replace any removed soil and sod, and you are all set to move on to your next site.